This is the training DVD for the OCN Enhanced Skills for Cancer Patients course. The techniques demonstrated in this DVD are the ones that are most regularly used when treating cancer patients. Neurovascular holding points. These are universal points recognized in general therapy. By holding certain neurovascular holding points with a light touch, the blood will circulate more effectively to the brain. Increased circulation can help you respond to life stresses in a healthy way. It can calm the nervous system and alleviate headache, neck pain, and tension in the jaw. The support can be held for emotional balances. It will help calm and relax. So basically what Patsy is doing here is she's touching on all the different neurovascular points, applying very, very gentle pressure, either holding still on the point or very, very gently circling on the points. She's working now on point 4, and that point connects to the spleen. And you will have a diagram in your handout, and all of these points will be explained. So it probably would be a good idea to actually have your handout with you when you're actually viewing the video. This treatment is deeply relaxing, and it helps to clear a busy mind. With all of the treatments, it's really important to really just clear your own mind and make the connection with the patient. And you might find from time to time you'll go off to a point that isn't actually on your diagram, but that's okay. And once again, you can use this as a treatment or a part of any of the other treatments. So what Tracy's demonstrating now is the stroke down. Starting at the top of the arm and placing your hand over the patient's hand, you just very, very gently stroke down the arm. This is usually done underneath clothing with either a sheet or a towel over the person, but for the purposes of this demonstration, we're actually bringing the arms out so that you can see it clearly. She's then started at the hip, and she's moving the whole way down the leg to the end of the foot. And each movement is done 3 times. And then she goes from the top of the arm, the whole way down the body, to the end of the foot. And whilst this is being demonstrated, we are just showing you what way the treatment is. But at any time, if you feel like stopping, you can just stop. You can take a breath If your patient takes a breath, really what you're doing is connecting and delivering this treatment and tailoring it to the patient. So you can stop at any time and using the warmth of your hands just to penetrate down into the body. And this is repeated now on the other side. It's a really good idea to synchronize your breathing again with the patient's breathing, because that adds to the relaxation effect. Once you've completed the stroke down, you very gently hold on to the patient's feet. Firstly, apply the massage medium to the patient's feet and legs. This treatment is usually done using both hands at once. Begin the massage by using the fingers of both hands to massage 3 circles over the toes and the top of the foot. Inner ankles, and then the outer ankles. Repeat 3 circles 3 times. With forefinger and thumb, make 3 circles down the outer edges of the feet, beginning at small toe and ending at heel. Fingers should cover outer edges of feet and thumb should cover soles of feet. Repeat 3 times. Six of hands, starting at the heels, do 3 circles, starting with sweeping inwards from outer edge of heels to inner edge. Then repeat sweeping circle on instep and out. And then finish on the balls of feet and toes. Repeat these movements 3 times. The movement is using the back of the hand, sweep into the instep and down around the heels. Sweep back to the instep and circle in opposite direction around the ball of the feet and toes. This movement is like drawing a figure of 8 with the back of the hands on the soles of the feet. Repeat 3 times. This sequence may be repeated for duration or as part of a treatment. The movement should be slow and regular. Like all our treatments for cancer patients, the pressure is very gentle and light and is to encourage the relaxation response. This is a holding technique developed by Patricia McNamara in the Hammersmith Trust. It treats the whole of the being without applying pressure. Skin barrier to the outside world, blockages, temperature, movement. Muscle, main bulk of body, interactions and how they do things. And bone, structure of person, what holds them upright, the core of belief system and connection with spirituality. Treats the mind, the body and the spirit. It's used on big muscle areas, arms, legs and shoulders. Place your hand on the area and visualize connecting with the skin through to the muscle and then the bone. And get the patient to do the same, visualizing as you connect with each layer. The movement should be slow and regular. Like all our treatments for cancer patients, the pressure is very light and very gentle, and it is to encourage relaxation. Okay, Patsy, so just now take a nice long breath and close your eyes and just relax. I'm just going to place my hand very gently on your upper arm, and I'm just going to connect. Just feel the connection between my hand and your skin, and the warmth of my hand on your skin. I'm just going to apply very gentle pressure and just take that connection down through the superficial muscle and into your deep muscle. And I want you to feel the difference between the connection with the skin and the connection with the muscle. And be aware of being back in your own space with the patient back in their own space. Again, ask the patient to feel the disconnection as you visualize your way back out again. So place both your hands on the patient's shoulders and ask them to take a long breath. Say long rather than deep, because some of our patients can't actually take deep breaths. If you ask them to take a long breath, you know how long is long. So just keep your hands on the patient's shoulders, and then working in a clockwise direction, you place your left hand on their right shoulder and your right hand on their hip. And you just hold. Just for a few seconds. And then you put your left hand on their left hip. So you're working clockwise around the back. And then your right hand goes to their left shoulder. And you hold. And then both hands back on the shoulders again. And then both hands on the hip. Sometimes you need to kneel down to this because you don't want to overstretch yourself. So then your right hand goes onto their right knee, and again you hold, and you repeat this on the opposite side. And really it doesn't matter which hand you hold with, but you need to be comfortable in yourself, that you're not straining yourself in any way. You just set both hands on to the heels. And again, in your mind, you're just holding a picture of balance and harmony. Balance to the left side and the right hand side of the body. And now you place your right hand on the right shoulder and your left hand on the heel, and you hold again. And you repeat on the opposite side. And then place both hands on the head to balance the left and right brain. Balancing the left brain, you place your right hand on the neck and the left hand over the left hand side of the head. And again, you repeat on the opposite side. And then gently, very gently, hold the head, placing no pressure at all. Throughout this treatment, you're synchronizing your breathing with the breathing of the patient. And to finish, you hold the soles of the feet to help them to ground. So each patient is unique, and it is important to tailor the treatment to their needs. So even though we're demonstrating, and it might look quite clinical, the amount of strokes and that, it is important that you actually tailor the treatment to the individual. So connecting with the patient is important, synchronizing your breath with theirs, working gently with slow rhythmic movements. Sometimes you might just feel you need to stop in a certain place, and that's okay. So each treatment with each patient will be different.